according to Statistic Canada, over a quarter of the 1.65 million Canadians that are over the age of 45 have parents that are in need of care. And sometimes, unfortunately, that care has to occur remotely. Sometimes we live in Toronto and our parents may live in Thunder Bay. So when that happens, I mean, sometimes we're in need of additional resources that will help facilitate and accommodate your parent as they do grow older and allow them to live a life with dignity. And joining us to tell us more is Mary Graham, who's the Area Director of Kitchener-Bayshore. Welcome to the show. And I mean, again, this is a changing movement in aging. Our requirements are different than what they were 75 years ago. Again, seniors are looking to live a far more independent life than what had previously occurred, because often our parents would live with us or other family members. So maybe you could describe us a bit about, I mean, again, the sort of things that people face when they do have parents that live not in their city.
Okay, so certainly for the adult children, they're often very concerned about their parents because, they're that far away. And very often older people feel that, I'm fine, don't worry about me. And so the parent will often tell the child, yes, I'm fine, but the child is really quite concerned. So there's really a number of things that people can do. One of the things is to enlist a friend or neighbor of their parent who might check in on them every so often. Another possibility is to arrange Meals on Wheels. Now, Bayshore Home Health has also offered a new service, and that is where a nurse can go in on a regular basis to do a health consultation. So it's really to be proactive and prevent a problem.
And I guess this is the important thing, is it's about acquiring information and making an informed decision. I mean, there are instances where unfortunately the senior may not be able to be fully independent in their home. They may have to look towards other services. But before we jump the gun, I mean, I've been participant in a number of discussions where it almost seems that decisions are being made on the parent's behalf without necessarily getting their input, but also looking to all available options. So this is where dialogue and information are very important. So how would a child go about getting this information and maybe arriving at a proper kind of solution for their parent?
Well, first of all, you hit a really good point. You want to involve the parents. You don't want to just make decisions for them. Statistically, we know that people prefer to stay in their home, and we really want to avoid people getting in a crisis situation. So the child, one of the things that they can do is certainly educate themselves, and so there's a variety of ways in doing that. Certainly, if they were to call Bayshore, we try to tell them about the various options that are available to them. So that may be that mom or dad needs a little bit of help in their home in order to stay independent, or maybe it's talking to them about different activities within the community that they should get involved, so to encourage socialization and again, physical activity. So there's exercise programs that are geared for seniors as well. So as far as getting more information, going onto the website, looking for ideas for seniors for that.
And I think you touched on something very, very important, because I mean, unfortunately, often seniors do become housebound, and I mean, there is that. I mean, as you said, it's important for them to participate in activities outside of the home from a social standpoint, but also to get them active, to continue to maintain and improve the quality of living that they have. So, touching on those resources that are available in an organization such as Bayshore, obviously, again, has the resources to facilitate those discussions between a child and their parent. What are the sort of other things that might be considered for the home?
Well, all cities have senior centers, so I mean, that's a possibility, but certainly within the home, I mean, getting Meals on Wheels for them, maybe getting some assistance with housekeeping, because that may be, becoming more difficult for them to do. And, often they've worked very hard, why not have a little bit of housework? The other thing is to think about safety. So doing some checks where you want to prevent a fall. So getting small carpets off the floor, getting some grab bars in the bathroom, and those are all preventative types of things. Maybe mom or dad does need a bit of assistance for walking around, not necessarily within the home, but possibly a cane or a walker outside of the home. And again, sometimes older adults adults think this is taking away my independence, but these little things can actually help them become more independent. And one of the things we really want to avoid is a fall. A fall can lead to a fracture, hospitalization, and possibly placement in a long-term care facility or nursing home.
And this is the thing, that there are, I mean, I know in my grandmother's case, I mean, she was very, very independent, and she didn't want to leave her home until it was necessary, and there were the systems in place that, you know, if she did have a fall, there were a panic, there was a panic system that could be hit, and at which point the paramedics would be notified, and someone would come in and check on her. And these are all the sort of things to extend that opportunity for the parent to reside in their home and safely.
Yes, yeah, and you know, you mentioned about, you know, having a call bell. That's a really good thing too. But I guess what you want to do is get some resources, investigate what's available for your parent, and put something in place before there's a disaster. And, you know, doing that fall risk assessment in the home, doing a nutrition assessment. Again, sometimes we do find that older people, you know, they've kept that food in their fridge that has gone bad. So, you know, engaging someone to check that fridge every so often and making sure that that food is removed that has gone bad, and that they are eating healthy.
And again, and this is why it's essential to employ the services of people that are trained to consider these things, a professional in long-term care, Bayshore being a strong example of that. And you know, to have a discussion with your parent, with various different caregiving services that are available, and arrive at something that's informed and will allow your parent to have an enjoyable quality of life and still maintain their independence where possible. And again, the website is
Bayshore.ca.
Wonderful. For more information, well, thank you very much for being on the show today. And